The Parliamentary Committee on Health toured Butabika Hospital, first with the patient's ward, the children's ward, a fully fledged pharmacy, alcohol and drug unit, state-of-art laboratory services, newly installed MRI machines, chemistry analyzers and patient monitors. The members of the Health Committee, headed by Dr Charles Ayume, interacted with some of the patients and staff of the mental hospital, and one of the key issues identified was inadequate funding and inadequate human resource.
We need to prioritize training of more psychiatric nurses to be able to come and work in these wards where we have very aggressive male patients. The other thing that stood out was there are only about 47 psychiatrists in the country. Now, of course, that is a mirror image of what we are seeing at regional level hospitals. We observed at the height of the second wave, that most of the psychiatric wards at regional level hospital had been repurposed as COVID treatment centers. And that means the psychiatric wards were housed in very small units, and this affected the quality of service delivery. So we are saying when Ministry of Health is able to get temporary shelter in terms of tents for COVID treatment centers, then psychiatric wards in the regional referral hospitals should go back.
Dr Charles Ayume also urged Butabika Hospital to decentralize mental health issues to grassroots levels and schools to avert the increased cases of drug abuse in the country.
We're also advising Butabika and Ministry of Health that let us see a situation where we have psychiatric services cascade down to general hospitals, to health center force, and to the community. We should have a lot of community sensitization, health education. Most of the patients are people who have been exposed to either international schools, who have lived abroad, who are from affluent backgrounds. So one of our strategies that we are proposing is taking health education, health promotion to universities and to schools to prevent the situations that we are seeing there. Children being exposed to cocaine, pethidine, and heroin.
The Executive Director of Butabika Hospital, Dr Juliet Naku, highlighted some of the challenges the hospital is grappling with in addressing mental health issues in the country. She cited that at least 12 hectares of hospital land has been encroached on.
Ministry of Health to try and check this vice. We have gone a very long way. They have been very, very supportive, and as a result, we've been able now to fence most of the land that we have. We still have an area to fence off, but I believe that we are now nearing getting on top of this problem of land encroachment. The wall is going to help us also to prevent escaping of patients from the hospitals.
Butabika National Referral Hospital is the only mental hospital in the country and aims at strengthening specialized mental health care services in the region. Zahara Abigaba, UBC.